again. Hello, everybody. Happy Monday, and welcome to Barriers to Exercise. My name is Sydney Szczesniakowski. For those of you who do not know me, I am your wellness tech here for Pinellas County. So I am half of your wellness program, and I'm excited to talk to you guys today. We're going into the new year. Plenty of people make New Year's resolutions to move their body more or just to start exercising in general. And I love New Year's resolutions. Some people say it's fruitless. I love them. I think it's a great way to kind of ride the wave of motivation to get started. And as we all know, life is complicated, life is difficult. It's not always linear, it's not always easy. So barriers and obstacles will come up. And when they do, it's important that we know how to navigate those so that we aren't thrown completely off track, because that's when, the motivation slips, you start to miss your goals. So it's important to kind of redirect when we come across these barriers. So that's really what today's presentation is all about. Quickly for our agenda today, we're going to go over the exercise guidelines, who's meeting them, who's not, benefits of exercise, why should we care, why should you care? You tuned in today, and I'm so proud of you for showing up today. That's a great step, but it's like, why should you care to do any of this? We're going to go over some common barriers, then some strategies on how to overcome them, and then just some final tips and takeaways at the very end. All right, so we're going to take a look at the exercise guidelines. These are provided by the American College of Sports Medicine. So adults 19 to 64, which I'm assuming is most of you guys here today, you should aim for at least 150 minutes of moderate intensity activity in bouts of 10 minutes or more each week. So 150 minutes, when you break it down, you could do 5 days a week for 30 minutes. You could do 3 days a week for 50 minutes. It's kind of whatever interval works best for you. Don't let 150 minutes scare you. It's just the recommendation throughout the entire week. And then all adults should undertake muscle strengthening activities such as strength training or resistance training, yoga, or just anything that really encourages your muscles to overcome a load that is heavier than what you're used to for the most part. And I want to touch super quickly on exercise intensity. It's right over here with 150 minutes, or if you see below that, 75 minutes of vigorous activity. So exercise intensity can be different person to person. For example, you may breeze through a run super casually, but your friend over there is gasping for air and has had to stop 15 times throughout of it. You want to think of moderate intensity as you can talk to someone while doing the activity, but you really wouldn't be able to sing them the national anthem by any means. And you may be sweating lightly and your heart rate has picked up just a little bit, nothing too crazy. Where on the other hand, if you're performing vigorous activity, you wouldn't be able to get more than a few words without pausing for breath. So moderate intensity is kind of where most people like to sit because it's less aggressive on the body, whereas vigorous activity is a lot more strenuous and it takes longer to cope from as well. Also, for the ACSM guidelines, we just want to minimize the amount of time spent sedentary for extended periods of time, which if you work at a desk for majority of your day like I do, this is a big one to hit home about. So in 2020, 24.2% of adults met the 2018 physical activity guidelines for Americans for both aerobic and muscle strengthening activities. So just to recap, only about 24% of the American adult population met these guidelines. These guidelines are put out as a blueprint for how we can improve our health. But what exactly are the benefits? Again, why should you care about any of this? We're going to go through kind of 3 main categories, and I'm going to elaborate on them as well. Prevent and manage chronic disease is going to be a big one. So regular aerobic exercise, such as walking, brisk walking, running, if you're really into that, but rowing, swimming, anything that kind of gets that heart rate up a little bit is going to be aerobic exercise. It helps strengthen the heart, allowing it to pump blood more efficiently, which can help lower blood pressure. Exercise enhances insulin sensitivity, meaning the body can use glucose more effectively. Light to moderate intensity exercise can lower blood sugar levels for up to 24 hours. So that's really important for those of you who struggle with insulin resistance or anything along the lines of like type 2 diabetes. Inflammation is the body's response to stressors, which is important in situations such as illness or your flight or fight response. It's good. However, chronic inflammation is linked to certain conditions such as heart disease, arthritis, and diabetes. Exercise boosts the production of anti-inflammatory molecules that promote tissue healing and repair. So a little bit of stress is good, a little bit of inflammation is good, but when you get into that chronic inflammation, that's when it can cause certain conditions. Additionally, having high amounts of visceral fat, which is just going to be the fat that surrounds your organs, like the liver, the pancreas, and the intestines, can also increase inflammation. Regular exercise can help decrease that visceral fat. So inflammation comes from a few different sources, but exercise helps target all of them. A combination of aerobic and resistance exercise can reduce visceral fat, so that fat around the organs, up to 10% in just 6 months, even without significant weight loss. So if you're monitoring the scale after you start exercising, stop it. Stop it. Don't do that. Don't do that to yourself. Body composition, which is kind of just how your body is made up of, you can have fat mass and you can have fat-free mass. So your muscle is going to weigh more than fat. So you may even notice the scale kind of switching around a little bit when you exercise. That doesn't mean that you're gaining fat. So don't let that scare you by any means. Exercise aids in changing the composition of your body, which helps create more of that muscle mass, which is good. That's what we want, and helps decrease fat mass. Speaking of muscle mass, I don't want this number to scare you guys, but typically muscle mass peaks in your early 30s. After this peak, muscle mass gradually declines, but is accelerated in those who are less active. Bone mass begins to decrease around this time as well, particularly in women, which if you have ever met me, I will rant and rave about strength training till I'm blue in the face, but I will especially emphasize it for women. Men have a later onset and slower decline in bone mass compared to women, usually after about age 50. So strength training for both men and women are crucial in establishing, but also maintaining muscle and bone mass. Exercise increases circulation throughout the body, helps reduce that inflammation, and reduces stress, which can all aid in supporting your immune system. And then according to the CDC, regular physical activity helps lower your risk of breast, kidney, colon, bladder, esophagus, lung, stomach, and endometrium cancer. So lowers the risk of 8 types of cancers. This is also another big one, and I know those who do exercise can speak to this one as well, and this should not, aside from the physical benefits, the mental health benefits of exercise are incredible. Exercise stimulates the release of endorphins that reduce pain and promote happiness. Serotonin levels increase, which help regulate mood, sleep, and appetite. Dopamine production is enhanced, improving motivation and focus. Like we just mentioned, inflammation, there's a good amount of it, just like stress. There's a good amount of stress, but like chronic inflammation, chronic stress can lead to heart problems, a weak immune system, and even chronic pain in some people. Physical activity helps lower cortisol and adrenaline levels, which are your primary stress hormones. Exercises, especially like yoga and Tai Chi, they help combine movement and deep breathing and mindfulness for kind of an overall calming effect. I know yoga can be really difficult, but when you kind of focus on that breath work and that connection to your body, I know it kind of sounds a little spiritual to some and that freaks some people out, so they don't really try it, but give it a shot and see how you feel. And achieving fitness goals, no matter how small, provides a sense of accomplishment and boosts self-esteem. Many people begin exercising because they want to change how their body looks, but continue exercising because of how good exercise makes their body and their mind feel. This is why I love New Year's resolutions. If it's just going to take you to get started, so be it. Whatever it is, it doesn't matter to me. But once you notice how good you feel from exercising, let that be your motivation to keep you going. And then taking 5 to 15 minutes for movement during moments of high stress can help allow you to reset and gain new perspective, which is why we do Friday stretch breaks, the midweek movement snacks. Taking just a little bit of time to yourself kind of helps provide that mental timeout where you're just like, okay, I need to focus on myself. I need to reset and go into this with a new mindset. And movement is a great way to do that as well. And then exercise not only improves physical resilience, but also mental resilience. By facing physical challenges such as running just a little bit faster or walking 10 minutes more than you used to, or going up in a weight on a movement, by facing these type of physical challenges, both your mind and your body must work together to push through any discomfort, any fatigue. So it really helps build that sense of resilience. Quality of life and longevity. This one is going to be a super important one as well. So, as mentioned in prior slides, physical decline is most prominent in those who are inactive. It is never too late to start exercising, and you are never too far gone. A combination of aerobic, so stuff that's good for your heart, and resistance training, your strength training, can help maintain and improve joint health, mobility, and strength can reduce the stiffness and discomfort and help decrease your risk of injury. I have talked to plenty of people who are, they're like, I'm, in my late 40s, 50s, it's exercise, whatever, it's too late. It's never too late to get started. You are never past the prime of it. Exercise has benefits to everybody, no matter your stage in life. This is going to be a little sciencey, but it's an important thing to touch on. Exercise boosts the production of brain-derived neurotrophic factor. So it's BDNF, and higher BDNF levels are actually associated with improved memory, learning, and overall cognitive health. So your brain health, your cognition, kind of, are you with it, essentially? Exercise can help improve those factors in your brain to help support that health. All of these benefits of regular physical activity can be summed up by the concept of health span versus lifespan. Lifespan answers the question of how long do you live? You have a lifespan of 100 years. That's how long you're going to live, 100 years. Health span, on the other hand, answers the question of how long do you live well? I think most people would like to live a long life. I'm going to go out on a limb and say that I would assume majority of people would like to live a long life. But say if you spend the last 10 years of your life with declining health, how long did you actually live your life? The power to take control of your life and set yourself up for a healthy old age is ultimately in your hands. It is up to you and no one else to overcome exercise barriers. It is up to you to make medical decisions. It is up to you to eat healthy. Some of these choices can and will be extremely challenging, especially depending on your circumstances. But it is also up to you to seek out resources and find solutions. And I know accountability can be scary, especially when we really start to think it's like, okay, this is life, this is my life, and sometimes it's great, sometimes it's not, but ultimately it's my decision to make it better. So while it's scary to come to that realization, it should also feel empowering knowing that you are the only person in control here. Ultimately, it is your decision on what you do with your health. So before we move into barriers to exercise and explore their solutions, I want to let you know that I'm proud of you for being here today and seeking to learn more about how you can make healthy decisions for your life, because that's the first step in gaining control over these things, is seeking out resources. All right. Common barriers to exercise. Let's take a look at some of these so that you can more easily begin to reap the wonderful benefits of physical activity that we just talked about. So, upon first glance, I'm going to take a second. Do any of these barriers resonate with you guys? Tuning in today, take a look at these. So sorry, I have a hiccup. Take a look at these. Do any of these connect with you? Or do you have a barrier that's not even listed on here? Because these are kind of the ones that I've seen the most throughout my career. But say you have a barrier that is not on here. Do any of these resonate with you? And I'll take a second. If you guys wanted to kind of share your input here and make it a little bit more personal so that I also know the audience I'm talking to. And if not, if you don't want to share, no worries. Like I said, I will provide a handout for you guys so that on your own time, in your safe space, you can explore your own barriers. Time and motivation of, yeah, absolutely. Absolutely. I would say arguably time and motivation are two of the most popular ones, probably with fatigue running a close third. Physical limitations, yeah. Limited access to equipment, lack of time, lack of knowledge. Gotcha. And also just a preface, kind of like I mentioned earlier with the New Year's resolutions, these could just be, maybe you want to exercise more. Maybe you go for walks, but you want to do more. Exercise is not an all or nothing thing, and these barriers don't exist in an all or nothing spectrum either. Time, motivation, physical limitations. Gotcha. Definitely. Long days for sure. I think that's where that fatigue really, really, really comes in for. No motivation. All of them? Fair enough. Fair enough. Absolutely. Self-sabotage. That's our brain. That's our brain working against us. But we'll talk a little bit on that kind of towards motivation. All right. Childcare, absolutely. So responsibilities, your daily responsibilities, stuff that you actually have obligations to that kind of take over. I get you. Exercise is definitely one of those things, one of those first things that gets pushed to the side. All right. You guys had some awesome input. I'm going to go ahead and we're going to take these one by one. We're going to take these one by one. All right. Lack of time. Kind of how I just mentioned, exercise becomes a low priority amongst everything else that you are juggling. But we kind of have to stop and think about, all those benefits that we just went over, physical, mental, longevity of life. We have to take a second, and this is kind of our accountability portion of this. All those benefits we just talked about, are those a low priority to you? Is living a healthy life a low priority to you? Your schedule will never magically have time for you to exercise. You must be intentional, but also be realistic with yourself. If you're like, okay, I want to exercise more, New Year comes around, I'm in the gym every day. Pause. Is that realistic for you? Is that something that you can do? If not, why are you setting yourself up to do that? We want to take a look at sustainability. What are you going to stick with? It may not be going to the gym every day, but it may be going to the gym 2 times, 3 times. It may be taking a walk before or after work. What is something that you can reasonably commit to? Take a look at your schedule, literally hour by hour. Could you squeeze in a 30-minute workout before, during, or after work? Could you take a 10, 15-minute walk in the morning, afternoon, evening? How often do you mindlessly watch TV or scroll on TikTok after work? You kind of need to take that empty time and make it worth your time. And I know when we break it down, it can seem overwhelming, a little annoying, but especially if time is something that you struggle with, it can be of benefit to seriously take a look at your schedule and go hour by hour. That's the realistic part of it. That's the intentional part of it. If we just say that we're going to exercise when we have the time, when do you have the time? Truly. You kind of have to work it in when you can. Physical limitations was another one we saw. So when something is uncomfortable, our natural response is to avoid it. And that's completely fair. If running is painful for your knees, walk. If yoga is incredibly difficult for you, use weights to strength train. If walking makes your lower back sore or your knees sore, swim. Talk with your physician, about your options and potentially enlist the help of fitness professionals like a personal trainer. If physical limitations and health concerns is something that is really serious to you, maybe seeking out the resources and seeing who is on your team that can help you out. But also just explore different ways to move your body. Exercise does not look like one thing. You do not have to run. You do not have to lift weights, although I would argue that you do, but you can also do yoga. There are tons of different options that you can explore. Do not feel like you have to do just one thing. Allow yourself some flexibility. And just a quick plug, for those who are on the county medical plan, free digital physical therapy is available to you through Hinge Health if you are really struggling with some of these aches and pains that you cannot easily push past. Limited access to facilities/equipment. I saw that one come up as well. Just a few kind of solutions here for you. We do have the Downtown Clearwater Wellness Center. It is a 24/7 facility that is free to Pinellas County employees, retirees, and volunteers. And if you do not have badge access, please reach out to me so that we can set up an orientation and get you going. On the next slide, we're going to go over some of the You Decide discounts that you may not know that you have access to, but also body weight exercises or walking/running. You don't have to do both. You can pick one. You don't have to pay for a gym membership. In the long run, it's probably going to benefit you too, but you can definitely start off with, putting on a YouTube video of 30-minute at-home exercises, no weights. You can seek out what you need. You just, again, have to be specific, have to be intentional. The resources are out there. The internet is abundant. You kind of have to target it for what you're looking for, though. Like I said, quick mention, You Decide discounts. It's just pinellas.gov/employee discounts. This has a ton of stuff on it, but if you go to the health and fitness section, this is just a quick screen grab of it. There's a few more items on there. There are discounts to certain gyms in the area. So if you really find one that you love and you're looking into it, maybe pop on You Decide and see what is available to you. All right. Fatigue, low energy. I know this one is going to be rough. And kind of like how I mentioned with time, if you are waiting for the perfect moment when you are bursting for energy with exercise, it may never happen. And again, realistically, how often do you feel like that? How often do you feel like you are the most energized and you are going to go run a marathon? How often do you feel like that? Unfortunately, exercise is kind of a paradox. It can make your muscles feel physically tired, but you will feel more energized afterwards. So find, if maybe you have peak energy time, maybe morning, mid-afternoon, evening, if you get off work every single day and you are tired every single day and you cannot pull yourself to the gym or to exercise at home, if you cannot do that, try not to wait until the end of the day. I don't know how many of you want to be 5 a.m. gym goers, but I've heard the gyms are less busy during that time. But if that's when you have the most energy, commit to that. All of these are going to be super personal. You really have to look at your lifestyle and figure out what you need. But take a look at your energy peaks, like I mentioned, and figure out what the best time for you would be. And don't just leave it to the end of the day because all of a sudden it's 10 p.m. and that's not going to work for you, unless it does, which props to you, but it may not. Lack of knowledge, know your resources. Wellness team, me, my program manager, Jane, group fitness classes, even online search. Knowing what to do for exercise is kind of half the battle. While the internet is a great tool, it can also feel overwhelming. We are happy, more than happy, to help point you in the right direction, but it is again your responsibility and on your time to reach out seeking for those resources. I spent years in school knowing how to do this. I still Google YouTube videos for yoga. You aren't just going to magically know how to do everything, and that's okay. But at the end of the day, it is your responsibility to seek out these resources because I promise you they are there. You just have to ask for them. Another kind of big one, and this, may ebb or flow depending on where you exercise, but a fear of judgment or low confidence. One of the best ways to overcome anxious feelings in the gym, especially kind of in the gym, if you're physically going to a location, is go in with a plan. This helps provide structure to your workout and eliminate that feeling that you're kind of like bumbling around and you're not sure what to do. So have a game plan, wear a cute outfit, find a community, friends, family, co-workers. And again, be patient with yourself. Everybody has a starting point. You may not know what to do and feel super confident in it your first day in the gym. That's okay. You just have to keep going. You can and you will push past those feelings. Lack of motivation. Motivation is going to ebb and flow. It is always going to ebb and flow. Focus on the benefits of exercise and rely on your routine. Motivation is not always consistent, but if you have a routine, if you know what you're going to do, you know why you're doing it, those benefits of exercise, know what you're doing, why you're doing, rely on that rather than a feeling that can just kind of fleet, it can kind of just go away. It's not the best idea to rely on motivation to get you to the gym for that reason. It kind of comes and goes. And it's not uncommon, like how we dropped in the chat and you guys shared, it's not uncommon to face more than one barrier to exercise. Along with the recording of today's presentation, you will also be provided a handout that can help you explore your personal boundaries and explore different solutions. So I promise I will be sending that out for you guys so that you can kind of take your time with it and think through some of these barriers. And then just some final tips and takeaways. The benefits of exercise extend beyond your current physical state. Like we mentioned, your mental health as well. That is a huge one. And ultimately, your longevity, your health span, how long you're going to be healthy while you are alive, essentially. There will always be obstacles in life that you and only you are responsible for overcoming. Again, like I mentioned, there are so many resources out there. You just have to know to ask for them. And again, I am here for you as a resource. Please ask for them. It's what I love doing. Have a plan when it comes to your fitness journey. Set yourself up for success. Don't just be like, you know what, I'll exercise when it happens. I'll do whatever. I'll go into the gym, play around with a couple machines, call it a day. Have a plan. Work with yourself, work with your schedule. You cannot rely on motivation to change your life. You must work to achieve the results that you want to see. Again, motivation ebbs and flows. It's always going to be coming and going. Rely on your routine and rely on the benefits of exercise. You are doing this to live a healthier life. That is why you are doing this. Trust in that. And then again, finally, if this is the last message I give, learn how to seek out resources. You are not alone in your fitness journey. You have me, you have community, you have coworkers. You are never alone in trying to make your life healthier. Again, there are resources out there. Please be willing to seek them out. With that said, that's going to wrap up today's presentation. Again, I really